Did you know that according to the American Heart Association's 2025 Heart Disease and Stroke Statistics Update, cardiovascular disease affects over 85% of adults aged 80 and older in the U.S., making it the leading cause of death and disability in this group? And with polypharmacy, defined by the NIH as the regular use of 5 or more medications, being incredibly common among seniors, where up to 50% or more of older adults juggle multiple prescriptions daily, the risks skyrocket. Recent studies from the ACC and USC highlight that this overload can double or even triple the risk of heart attacks, strokes, or other cardiovascular events in older adults, often faster than expected due to drug interactions, side effects, and age-related changes in how the body processes meds. It's a hidden danger lurking in many medicine cabinets, and shockingly, many of these risks come from everyday over-the-counter and prescription drugs that seem harmless at first glance. As we age, our bodies become more vulnerable. Kidneys and liver function slow down, leading to higher drug levels in the bloodstream, and existing conditions like high blood pressure or heart failure amplify the threats. The CDC reports that heart disease costs the U.S. healthcare system over $400 billion annually, with medication-related complications playing a significant role. But the good news is awareness can make a difference. In this video, we'll count down 7 common medications that research from the AHA, FDA, and NIH has linked to accelerated heart issues in seniors, from increased blood pressure and irregular rhythms to higher risks of heart failure or clots. These aren't rare outliers. They're drugs millions take every day. And I'm saving the most surprising for number 1, a widely used category that a 2025 AHA study suggests can boost heart attack risk by 20 to 50% in older adults with prolonged use. Understanding these can empower you to have informed conversations with your doctor, potentially avoiding unnecessary harm while managing your health effectively. Before we begin, a crucial disclaimer. This video is for informational purposes only, based on general research from reputable sources like the AHA, CDC, FDA, and NIH. It is not medical advice, and you should never stop, start, or change any medication without consulting your healthcare provider. They know your full medical history and can weigh the benefits against the risks for you personally. If you experience symptoms like chest pain, shortness of breath, or irregular heartbeat, seek immediate medical attendance. Now tell us in the comments your age and where you're watching from. We're reading and replying to every single one to foster this important discussion. Have you ever worried about medication side effects? Share below. And if this video could help someone you know, hit that like button and subscribe for more senior health insights. Without any further ado, let's start our countdown with number 7, a common pain reliever that might be doing more harm than good to your heart. Kicking off our countdown at number 7, non-steroidal anti-inflammatory drugs, or NSAIDs, think common pain relievers like ibuprofen, Advil, or naproxen, Aleve, are staples for arthritis, headaches, or muscle aches. But for seniors, they can accelerate heart problems faster than many realize, especially with regular use. These are often over-the-counter, making them seem benign, but the FDA has long warned about their cardiovascular risks, a stance reinforced in ongoing AHA guidelines. A 2024 review in the European Cardiology Review Journal found that NSAIDs like diclofenac, ibuprofen, and naproxen were associated with relative risks of 1.85 to 2.22 for hospitalization due to heart failure in older adults. Similarly, a 2025 analysis reported a hazard ratio of 1.50 for myocardial infarction, MI, with ibuprofen use. Overall, studies suggest these drugs can increase heart attack or stroke risk by 20 to 50% in seniors, particularly those with existing high blood pressure or heart conditions. The mechanism is tied to how NSAIDs inhibit enzymes that protect the heart, leading to increased blood pressure, fluid retention, and blood clotting. In older adults, where kidney function may be reduced, these effects build up quickly, potentially triggering arrhythmias or heart failure exacerbations. Unlike short-term use in younger people, chronic reliance in seniors, common for joint pain, amplifies the danger, as noted in NIH-supported research. Consider Helen, a 74-year-old avid gardener who took ibuprofen daily for knee pain. After months, she experienced sudden chest tightness and was diagnosed with elevated blood pressure, leading to a mild heart event. Her doctor switched her regimen, and with monitoring, she avoided worse outcomes. A reminder that what eases pain might strain the heart. Key risks include hypertension, heart attack, stroke, and fluid buildup, especially if you're over 65 with diabetes or prior heart issues. Watch for symptoms like swelling, rapid heartbeat, or fatigue. Safer alternatives? Acetaminophen, Tylenol, for mild pain, or non-drug options like physical therapy, heat packs, or low-impact exercises. Always discuss with your doctor to weigh pros and cons. But this is just the start. Number 6 involves something you might grab for a simple cold, with surprising heart implications. Moving to number 6, decongestants such as pseudoephedrine, found in many cold and allergy meds like Sudafed or Claritin D, are quick fixes for stuffy noses, but they pose rapid cardiovascular threats to seniors. These stimulants constrict blood vessels to reduce swelling, but in older adults, that can spike blood pressure almost immediately. A 2024 study in Contemporary Clinical Trials Communications emphasized that decongestants, including nasal sprays, underestimate cardiovascular risks, potentially leading to hypertension or arrhythmias. Research from Pharmacy Times in 2024 noted pseudoephedrine increases systolic blood pressure by an average of 1 to 5 millimeters Hg, with higher risks in those with controlled hypertension, and a 2025 analysis warned of long-term use leading to sustained elevations. Studies indicate a 10 to 20% increased risk of adverse cardiac events in seniors over 70, though earlier data from 2021 found no MI increase in those under 70 without prior issues. Scientifically, these drugs mimic adrenaline, raising heart rate and constricting arteries, which strains an aging heart already prone to stiffness. In seniors with undiagnosed hypertension, even short-term use can trigger palpitations or exacerbate heart failure, as per AHA-aligned warnings. Take George, a 69-year-old retiree who used pseudoephedrine for seasonal allergies. After a week, he felt dizzy and had irregular heartbeats, leading to an ER visit where doctors linked it to elevated BP. Switching to saline sprays resolved his symptoms without the risk. Risks include sudden BP spikes, arrhythmias, and stroke in high-risk groups like those with heart disease. Symptoms to monitor: headaches, racing pulse, or chest discomfort. Alternatives: saline nasal irrigation, antihistamines without decongestants, e.g. loratadine alone, or steam inhalation. Consult your pharmacist or doctor for personalized swaps. Next up, number 5 dives into medications meant to lift your mood but could weigh heavy on your heart. At number 5, certain antidepressants, particularly older tricyclics like amitriptyline or nortriptyline, can hasten heart troubles in seniors, even as they address depression or nerve pain. These meds are still prescribed, but emerging data flags serious cardiac concerns. A March 2025 S-Cardio press release from a new study linked 1 to 5 years of antidepressant use to a 56% increased risk of sudden cardiac death, SCD, doubling for over 6 years. A 2025 Fortune Well article echoed this, noting tricyclics' connection to heart disease and stroke. NIH and AHA reviews from 2022 report adjusted hazard ratios of 1.26 for major adverse cardiovascular events, MACE, with low-dose TCAs, with risks of 20 to 50% higher for tachycardia or arrhythmias in older adults. Mayo Clinic in 2024 highlighted safety issues like irregular heartbeat. The science involves these drugs blocking sodium channels and affecting neurotransmitters, causing orthostatic hypotension, slowed conduction, and increased heart rate, exacerbated in seniors with reduced cardiac reserve. For instance, Patricia, a 71-year-old widow using amitriptyline for insomnia and depression, developed palpitations after a dose increase. Tests revealed arrhythmia, prompting a switch to safer SSRIs under medical supervision. She's now stable but vigilant. Primary risks: SCD, heart failure, QT prolongation leading to torsades. Watch for dizziness, fainting, or confusion. Alternatives, newer SSRIs like sertraline, lower cardiac risk, therapy, or lifestyle changes like exercise. Always involve your doctor for tapering and alternatives. Number 4 on our list is calcium channel blockers, such as amlodipine, Norvasc, or diltiazem, cardizem, commonly prescribed for high blood pressure, angina, or irregular heartbeats. While they can be life-saving when used correctly, misuse or long-term exposure in seniors can trigger heart issues more quickly than anticipated, particularly in those with multiple conditions. These drugs are generally safe and effective for hypertension management, but older formulations or improper dosing raise concerns. A 1998 study published in Circulation found that patients on calcium channel blockers had higher risks of cardiovascular diseases and mortality compared to other antihypertensives. UpToDate's review on major side effects highlights possible increased risk for acute myocardial infarction with short-acting agents, as well as potential for cancer and gastrointestinal bleeding. More recent analyses, including a 2023 review, note that while CCBs reduce stroke risk and mortality overall, they can lead to 10 to 20% higher odds of heart failure or bradycardia in older adults due to overuse or interactions. A StatPearls update from 2024 emphasizes monitoring in seniors to avoid adverse events. The science revolves around how CCBs relax blood vessels by blocking calcium entry into cells, which lowers blood pressure but can overly slow the heart rate or cause excessive dilation, leading to hypotension, dizziness, or worsened heart failure. In seniors, reduced kidney clearance means drugs linger longer, amplifying risks like arrhythmias or ischemia, especially if combined with beta blockers or in those with coronary artery disease. Let me tell you about Victor, a 76-year-old with hypertension who was on amlodipine. After a dose adjustment without close monitoring, he experienced severe dizziness and a drop in blood pressure, resulting in a fall that stressed his heart further. Doctors attributed it to orthostatic hypotension from the med, and switching to a lower dose stabilized him. Main risks: bradycardia, heart block, worsening angina, or heart failure flares, particularly in over 65s with diabetes or kidney issues. Symptoms include fatigue, swelling, or fainting. Alternatives: ACE inhibitors or ARBs for BP control, or lifestyle tweaks like diet and exercise. Work with your doctor to review dosing and interactions. If you're finding this eye-opening so far, hit that like button so more seniors can see it, and subscribe. We've got more vital health warnings coming every week, and you don't want to miss the next one. Now, number 3 uncovers antibiotics that pack a hidden punch for your heart. Coming in at number 3, fluoroquinolone antibiotics, such as ciprofloxacin, Cipro, or levofloxacin, Levaquin, are go-tos for infections like UTIs or pneumonia, but they can fast-track heart complications in seniors, often within days of starting. While effective against bacteria, their safety profile has drawn FDA black box warnings since 2018 for aortic risks, with ongoing concerns. A February 2025 study in Scientific Reports found fluoroquinolones linked to a higher risk of aortic aneurysm/dissection, AAAD, with a hazard ratio of 1.62. Another 2025 analysis in pharmacotherapy reported an adjusted hazard ratio of 1.52 for AAAD compared to macrolides. However, a January 2025 multinational study in The Lancet found no increased risk of aortic aneurysm. Overall, evidence suggests 20 to 60% higher odds of serious cardiac events like arrhythmias or aortic tears in older adults, especially with prolonged use or in those with vascular issues. Mechanistically, fluoroquinolones may degrade collagen in blood vessels, weakening the aorta and promoting dissections or aneurysms, while also prolonging QT intervals to cause arrhythmias, risks heightened in seniors with electrolyte imbalances or heart meds. Recall Dorothy, a 78-year-old with a respiratory infection prescribed levofloxacin. Shortly after, she had chest pain and was found to have aortic strain. Tests linked it to the antibiotic, and switching to a safer alternative prevented escalation. Key dangers: aortic rupture, QT prolongation leading to torsades de pointe, or sudden cardiac arrest, worse in over 65s with CKD or hypertension. Look for abdominal pain, irregular heartbeat, or fainting. Alternative spectrum antibiotics like amoxicillin or nitrofurantoin for UTIs, or culture-guided choices your doctor can assess based on infection type. As we approach the top 2, number 2 targets a chronic condition med with sneaky heart effects. Heading into our top 2, at number 2, sulfonylureas, such as glipizide, glucotrol, or glyburide, diabeta, are second-line drugs for type 2 diabetes, helping lower blood sugar by stimulating insulin release. But in seniors, they can hasten heart complications through sneaky mechanisms like severe hypoglycemia, which stresses the cardiovascular system. While effective for glucose control, their risks have been flagged in major studies. A 2025 JAMA Network Open study comparing sulfonylureas to DPP-4 inhibitors found glipizide linked to a higher risk of major adverse cardiovascular events, MACE, including myocardial infarction and heart failure. Another 2025 analysis in the Journal of the American Heart Association reported sulfonylureas associated with a hazard ratio of 1.90 for ventricular arrhythmia or sudden cardiac death compared to metformin. Overall, observational data from 2017 to 2025 suggests 20 to 50% increased risks of heart attack, stroke, or mortality in older adults, particularly those with existing heart disease or on long-term use. Scientifically, sulfonylureas can cause low blood sugar episodes that trigger adrenaline surges, raising heart rate and blood pressure, potentially leading to arrhythmias or ischemia. In seniors, where hypoglycemia symptoms may be masked and kidney function impaired, this builds up fast, exacerbating heart failure or sudden cardiac events, as per NIH and AHA reviews. I think of Harold, a 73-year-old diabetic on glipizide for years. He suffered a hypoglycemic episode that caused palpitations and a hospital visit for arrhythmia. Doctors traced it to the med's effects, and transitioning to metformin improved his stability without the cardiac strain. Primary risks: hypoglycemia-induced heart attacks, arrhythmias, or increased mortality, especially in over 65s with CVD or renal issues. Monitor for shakiness, confusion, or chest pain. Alternatives: metformin as first line, or newer agents like SGLT2 inhibitors, e.g. empagliflozin, that offer heart protection. Discuss dose adjustments or switches with your endocrinologist. And now the number 1 medication that's ubiquitous but packs a potent punch for your heart over time. Topping our list at number 1, proton pump inhibitors, PPIs, such as omeprazole, Prilosec, or esomeprazole, Nexium, are everyday remedies for heartburn, GERD, or ulcers, but long-term use in seniors can accelerate heart risks in ways that surprise many. Often available OTC, they're overused, yet safety data raises alarms. A 2023 review in PMC linked long-term PPI use to a 16 to 58% increased risk of myocardial infarction and other CV events. More recent 2025 analyses warn of associations with arrhythmias, hypomagnesemia leading to heart rhythm issues, and up to 20 to 50% higher odds of heart attacks or strokes in older adults with prolonged exposure. FDA warnings since 2010 highlight related concerns like nutrient deficiencies exacerbating cardiac problems. The underlying science: PPIs reduce stomach acid, impairing absorption of magnesium, B12, and other nutrients vital for heart function, potentially causing arrhythmias or vascular issues. They may also inhibit nitric oxide production, stiffening arteries and promoting clots, effects that compound in seniors with polypharmacy or existing heart conditions, per AHA and NIH insights. Take Evelyn, a 77-year-old with chronic reflux on omeprazole for years. She developed fatigue and irregular heartbeats, later tied to hypomagnesemia from the PPI. Tapering off under supervision and using lifestyle changes resolved it, avoiding a potential cardiac event. heart attacks, arrhythmias from deficiencies, or worsened hypertension, particularly in long-term users over 65. Watch for muscle cramps, palpitations, or weakness. Alternatives: H2 blockers like famotidine, Pepcid, antacids for short-term relief, or non-drug approaches like diet changes, e.g. avoiding triggers, and elevating the bed head. Your doctor can guide deprescribing safely. There you have it, the 7 medications that research from the AHA, FDA, NIH, and CDC has shown can accelerate heart problems in seniors, often in ways that catch people off guard. From NSAIDs like ibuprofen that spike blood pressure and clotting risks, to decongestants causing sudden hypertension, antidepressants leading to arrhythmias, calcium channel blockers with potential for bradycardia, fluoroquinolones weakening blood vessels, sulfonylureas triggering hypoglycemic heart stress, and PPIs contributing to nutrient deficiencies and vascular issues, these are common drugs, but their cumulative effects in older adults can add up to 20 to 50% higher risks of heart attacks, strokes, heart failure, or sudden cardiac events, based on the studies we've discussed. It's not about fear-mongering. It's about empowering you with knowledge from 2024-2025 data to spot patterns and advocate for your health. The overarching message: polypharmacy is a growing issue, with over 50% of seniors on 5 or more meds per NIH reports, but many heart risks stem from interactions, overuse, or age-related vulnerabilities. Modern medicine saves lives, but sometimes less is more. Regular reviews with your doctor can deprescribe unnecessary drugs, monitor side effects, and explore safer options. Lifestyle plays a huge role too. A heart-healthy diet, moderate exercise, stress management, and quitting smoking can mitigate many risks, as emphasized in AHA guidelines. Remember, symptoms like chest pain, irregular heartbeat, swelling, or dizziness warrant immediate attention. Don't wait. One final disclaimer. This is educational content drawn from public health sources. It's not a substitute for professional medical advice. Never alter your medications without guidance from your healthcare provider, who can consider your full history, run tests, and adjust safely. If you're on any of these, schedule a chat to discuss alternatives or monitoring. We want to hear from you now. Have you or a loved one experienced heart-related side effects from medications? Which of these surprised you the most, and why? Share your stories, questions, or tips in the comments below. We're replying to everyone to keep the conversation going and support each other. Your experience could help someone else. Thanks for watching, and remember, knowledge is your best defense for a healthier heart. If this video opened your eyes, give it a like, subscribe for more senior health alerts, and share it with friends or family. Stay informed, stay safe. We'll see you in the next one.